Welcome back to CBS This Morning. I'm Gayle King with Anthony Mason and Tony Dokoupil. There are increasing concerns about the popular heartburn drug Zantac and its generic version, too, because of a chemical that could lead to cancer. 3 large pharmacy chains in the U.S. recently pulled the drugs off the shelves following an FDA alert about an impurity in the medication. Now, Zantac is used by about 2 million Americans every year. Dr. Jon LaPook recently spoke to 2 groups of researchers who suspect the problem could be serious for consumers.
We take the entire tablet just as a patient would, and we dissolve it into the solvent.
At this Connecticut lab called Valisure, researchers test drugs from its own online pharmacy to check for purity and quality. Last spring, they analyzed a few heartburn drugs to see if they contained NDMA, a chemical known to possibly lead to cancer. That same chemical had led to recalls of some blood pressure pills last year.
So we're going to crush this.
Okay.
Into a
One
homogeneous
medication
powder.
stood out, Zantac and its generic version, ranitidine. It had levels of NDMA higher than considered acceptable. Valisure CEO David Light.
The active ingredient in Zantac appears to us to be a fundamentally unstable molecule.
Light reported to the FDA his suspicion that the problem is not just an impurity, but what could happen to the pill inside the body.
And in a variety of conditions of the lab, conditions of the human body, it can break down and then form the carcinogen NDMA.
You're saying the ranitidine itself can break down and form NDMA.
Correct.
That possibility, that ranitidine could be converted into NDMA inside the body, was suggested 3 years ago in research published by William Mitch, a professor at Stanford University. In a small study, 10 volunteers were given a tablet of Zantac and their urine was tested. NDMA levels were more than 400 times greater than what the FDA considers acceptable. The results held up when adjusted for updated FDA testing guidelines for NDMA in ranitidine.
We weren't expecting to see NDMA itself forming through conversion in the body.
So what was the implication to you when you saw that there was so much NDMA in the urine?
The implication was that there was a potential cancer risk.
3 months after Valisure first alerted the FDA to its findings, the agency issued a safety alert, saying its own testing found low levels of NDMA in ranitidine. It is now calling even those levels unacceptable. The agency told CBS News it is now investigating what happens to ranitidine inside the body after it's exposed to stomach acid.
What do you think happens going forward now? What would you like to see happen?
So what we've been petitioning for is for the complete recall of all ranitidine products. Brand, generic, doesn't matter who made it or what lot number it is.
Zantac's maker Sanofi told CBS News that the Mitch study has limitations. The company also said it is working with the FDA and doing its own robust testing. While Zantac is still being sold, some generic makers have issued voluntary recalls.
John, if they're calling for a complete recall here, should people stop taking these drugs?
Well, the problem here is there's so many questions that are unanswered. We do not know the answer to that, but I can tell you that Memorial Sloan Kettering, which is a top cancer research center in the world, has pulled ranitidine, which is the generic form of Zantac, from its pharmacy. And it is also doing an investigation to see if people who come in who are taking ranitidine or Zantac have an increased rate of having certain types of cancers. So lots of questions, and we don't have enough answers.
It's interesting here it was flagged. Something was flagged 3 years ago.
Yeah.
And we're still,
Why didn't somebody see that?
It was basically missed, John, is what you're saying.
Well, nobody saw it, or maybe they saw it and then they didn't act on it. So there are still so many questions. I know it's disquieting for people to not have, here's what you're supposed to do.
Yes.
We always fall back on, look, speak to your clinician and talk about the possible alternatives there are if that's something that you want to consider. There are lots of alternatives to Zantac and ranitidine.
All right, John, thank you very much.